Good morning. We will call the Health Committee meeting Wednesday, April the 9th. So if you would, Michael Ann, please call roll.
Representative Lee.
Here.
Representative Lipscomb. Here. Representative Hall. Here. Representative Sorrells. Representative Mooney. Here. Representative Warren. Representative Marcus. Here. Representative Gray. Here. Representative Rafferty. Here. Representative Paramore. Here. Representative Rigsby. Here. Representative Holt Jones. Here. Representative DeBose. Here. Representative Shiree.
Public hearings, 2 of those we finished up yesterday, and today is the 3rd one. We had our plate full yesterday, so we couldn't do all of it in one day. I would ask the first bill and only bill on the calendar to come. You've done a lot of work on this, and you can kind of give us an update on the sub. I believe, guys, you have the sub in front of you that is going to be proposed today.
Right. Yes, sir. And would you like me to start off addressing the sub?
Yes, sir.
How would you rather me?
Please, sir.
Okay. Thank you. Thank you, Mr. Chairman and members of the committee. I would like to say, first of all, that I've been in the House for a number of years, and I don't know of any bill that I've put this much hours in this amount of time. Sometimes, you work on one a whole year, but over the past, since we met in public hearing, I don't know how many hours the other interested parties put in to try to work out a workable solution. And I think that that's what we have before us today in the sub. And I know y'all been through a lot in some other meetings, but just to familiarize you with this, it's a bill to establish an associate level speech-language pathology assistant. And so there was a lot of, it's easy to say, but that encumbers a lot of different things and affects a lot of different agencies and that type of thing. But I think we've got to a good solution with the sub. The different ones that we've worked with, and I'll say Representative Collins and I, she's been involved heavily from the beginning, but the community colleges, the higher education partnerships, which is a number of the universities in the state, and we can list those out if y'all need those. That was at the table, and the Speech-Language Pathology Board, they had a lot of input also as in all the conversations that I had with them, and I appreciate those conversations and them meeting. We also have today here Dr. Purcell, who is over the Commission on Higher Education. He's here. He's been involved in the process and able to speak on it if the chairman and committee wants him to. So he's available.
Mr. Chairman, I'd move adoption of the sub.
Yeah, well, let's get the sub on the table. I have a motion from Representative Mooney, a second by Representative Gray. You need a question before? Yes.
Thank you, Mr. Standridge, and I want to say how much I appreciate the work that you all have done. We go to page 2, lines 50. You refer to this section, community college, but it said refer to Wallace State Community College, Huntsville. And then when you get down to 4 years, public institutions, that's any 4-year public institution. Why wouldn't you have any for 2-year community colleges?
During the discussions, there was a lot of things that came out about that. And one of the things is, I think that kind of drove that conversation was the availability of places where they can do their practicum work, where they can do that work and so they were concerned about that because of the number of community colleges that we have in the state. And so just based on the conversations and actually the agreement is to limit it, at least at this stage in the beginning, to the one college, be like a pilot program. to, number one, we feel like they're probably the only ones ready to move to the next step at this point, and also to be a pilot. And if the market demands that, then of course it can increase.
Then I think it should state that.
That's the intent. I'm not sure how we would state that, but that's the intent and the understanding that was developed during the conversations.
Would you be amenable to making that adjustment on the floor?
I would, if we could figure out the right terminology, and we have other agencies that have a lot of input in that. So, original bill obviously didn't have that in there, but this came out of the negotiations about the bill.
I mean, it doesn't take anything away from the community. I mean, it doesn't take anything away from the college that's listed. But to me, if you want it to be what I would say consider fair and across the board, that I think if the intent is for it to be a pilot program, then that's stated as a pilot program with the idea that other schools would have that opportunity as well.
Well, I'm personally okay with that. I hope it doesn't come across that I'm trying to make this just exclusive because that's a community college in my area. It is not. It is from negotiation with the other
I understand
parties.
But from the view that I have, thank you. But thank you.
Well, hold on just a second. Representative Warren.
Thank you, Mr. Chairman. And Representative, when I read this morning, it caught my eye because I don't think we have the authority as legislators to dictate programs and higher educational institutions. So if we're saying this, are we trying to restrict it? Because we don't have that authority. If a college decides that they want to do something and Sachs approves it, it's in their category. It's in their inventory. So I just don't think. I think the wording is very restrictive here, and it's giving us authority that we don't have as legislators.
Well, I am. You want me
go ahead. No, you go ahead. That wasn't part of my original bill, and obviously it's not something that is part of what our part. That came from other people that had those concerns.
Because I think we're going a little bit above our authority.
That was what that was kind of agreed on, not kind of it, what it was agreed on to let people be comfortable with us moving forward is they don't want to open the floodgates. Does that make sense? They want to make sure we're doing it correctly, and that there is a standard that is met.
Like I said, I understand what you're trying to do, but I'm still saying what our restrictions are by higher ed law and policy.
And Representative, I think that your point is well taken, and I think that's why we believe that we have the steps that we have for this very reason. If we had the amendment, we could move forward with that amendment today. So it was late in the game, but I think we've committed that you will work on that, Representative Hall and whomever else is involved in it, to work on that amendment on the floor when it comes. And I know your heart of I know what you're trying to do.
Yeah. I'm very amenable to that if that's what the committee desires and the membership.
And the end goal is, I think what brought this attention is we have a shortage for those that are in the high schools, and they're paying a ton of money and can't get them. I mean, it's not a matter of the cost at this point; it's just not availability.
Yeah, that's what's brought the whole bill.
Yeah, Representative Shirey. And no one has seen that, but when we get there, Representative Paramore.
Yes, piggybacking off of Representative Warren's comments, I think AIC has to approve as well if 2 or 4 year schools add something to their inventory as well, don't they? As far as coursework or degree programs?
They do.
So, I mean, that's another step in the process that we have to do. The 30 hours, 30 semester credit hours at a community college or university in speech and hearing sciences, et cetera, is 30 hours what is required at one of the four-year schools now at South and others that have this program?
And we can have Dr. Purcell, if he can help you
Yeah.
with any answers, well, he's welcome to.
It's language provided by them, so I'm assuming.
I just want to make sure
It's
that,
language that was provided by
yeah,
them.
I want to make sure we weren't lowering the number of hours at the four-year school that's required, just so that we have a quote-unquote equal playing field on number of hours between 4 year and 2 years.
Yeah, I think that was an agreed on section by the two entities. So my thought is that's what the standard is.
All right, and if we get more of these individuals in our schools and in the workforce, are they still going to be required to, only one licensed speech pathologist can only oversee two? Is that correct?
Well,
Three?
the this sub, what it does is, that was asked by several committee members to me, and so I went and looked at the national standard, and the national standard is 3 instead of 2. That was a state standard. So what I did was I added in the language in the sub up to 3, and talking to people in the profession and stuff, they said, and all of them said, there's settings that 3 is appropriate. There's settings that may not be appropriate. They may not can, because some are different environments. And so the wording is up to 3 in the sub.
And that's fine. I like 3 better, but my concern there is you put 25, 30 more people in the workforce, but at the level of the supervision, that number doesn't change. I mean, are we doing this for nothing, so to speak?
Well, I don't think so. And I appreciate you bringing that, because that is a legitimate question, but I can just speak from like the school environment. And when I talked to my personal superintendent, and he testified, the other day, but when I talked to him, he said, "Oh, that would be great for me," because he said, "I have 5 on, that could be supervised on staff now." And he said, so we could use these other ones to work under them, and he wouldn't even meet the 3. You know what I mean? And still be able to do that. I would say most school systems will be in a similar situation. So that I can only speak to that environment.
Environment's good, but there are probably going to be other environments, though, where they can only do 2 or 3. And if there's 8 or 10 there, it does us no good to have 8 or 10 if only 3 of them can be supervised. You got 5, 6, 7 sitting over here that have no supervision, therefore can't do the work. Am I correct in that, or am I missing the analogy?
Well, I don't think that there's going to be like some flood of, people. I mean, there's not going to be some flood of people. So, and that's dictated by, they're only restricted to that many. So obviously they couldn't be hired if they can't work unless they're by this bill, except under the supervision of one of those.
Representative Shirey, we'll come back to you, but we have a first and second for, yes, sir, Representative Rigsby.
Just real quick, thank you for bringing this piece of legislation in hopes to help those who need this kind of service. My question, kind of along the same lines, in that same paragraph there, line 40 through 44, where it talks about they have to complete 100 practicum hours. Is that required now? Okay, so those have to be under the supervision, I'm assuming, of a clinical speech-language pathology. So now you're putting an additional 3 people under that same person who may have students and being supervising actual assistants, correct? How many students can they supervise to do those clinical hours?
I don't know. Somebody can answer that. Do you know?
Anybody know that? And I use the analogy in pharmacy. A pharmacist can oversee 3 students and 3 technicians.
Mr. Chairman, could I defer to?
Yes, sir. If you would restate, I know you spoke the other day, who you are and what you do.
Good morning, Mr. Chairman and fellow members of the committee. I'm Vicki Karlowicz. I'm president of Wallace State Community College in Hanceville, Alabama. The speech and language pathologist would not supervise more than 3 assistants at any one time. Well, I think there's an assumption that every speech and language pathologist is going to have an assistant. That's not always true.
Right.
So we will partner with clinical agencies who can provide supervision to a clinical student.
So I guess just to be clear, I'm talking 2 different supervisions. One, they're still in the program. They're having to get their 100 clinical hours before they complete the program, right? How many students of those students can they supervise at a time?
It would certainly be not more than 3, and I
Okay.
believe that the students would count as part of the 3.
So we're assuming between the students and the ones who have graduated the program and are now assistants, there will be no more than a combination of 3 of those at a time.
That's what the rules say.
That's what your board rules
That's what
say?
VESPA's rules say.
Okay.
Not more than 2 right now, and we're hoping to increase that to
But that would be
3.
either student in the program or assistant who's been hired to work as an assistant.
Yes, sir, according to that language.
Thank you.
That's my understanding.
Okay.
All right, are there any other questions? So we have a motion and a second to adopt the sub. Those in favor by saying aye. Aye. Those against? The sub is adopted.
Mr.
All right.
Chairman, since we've gone through all the questions on the sub and it's now the main motion, I move that we adopt the payroll report on 441.
We'll get there, but I have recognized Representative Shirey. Representative Paramore.
You're saying they can supervise 3 students and 3 assistants. Okay.
I'm saying that the 4-year people graduated with a bachelor's are named differently. They're no longer just an assistant, they are a clinical. And the 2-year program would be just an assistant. That's all this is. CRNA or RN or
Chairman Stan, go ahead.
Well, are we planning to try to pass this at this particular point?
Well, I'm working that way, so if you give me a minute,
I'm just saying I don't have anything in front of me.
We do not have anything, but I think in this case, since we literally walked in after we started with it, and I'm not saying it's a bad amendment, but Representative Standridge, out of courtesy to you, is this a friendly amendment or not, or do you rather wait and deal with this on the floor? I just don't like those type of curveballs being thrown.
I would strongly request, Mr. Chair, that we would. I don't have any problem with the amendment, but just the process, and I'd like for us to, just as we are talking about the other parts that we're going to work on, if that could be a part of that conversation as well.
Okay, we have a motion to table on the floor. We have a second. To table, a yes vote would be to table. All those in favor to table this motion or this amendment by saying yes. All right, yes. Those against, nay. Okay. I believe I counted 4 nays, so this amendment is tabled. So now we're back on the amendment. Representative Mooney, you have made a motion to have we passed the sub yet? Yeah. This is a favorable report as substituted.
Yes, sir. Thank you.
Okay. We have a first. I need a second. Second, Representative Brinyard. All those in, I'm sorry.
Can I speak?
Yes, sir.
I would like to say before we vote that, first of all, I appreciate everybody's work, especially the ones out here that's worked, lots of hours. I told somebody I think I've worked 40 hours in the last 2 days on this bill, but on Representative Shire's motion, I haven't had time to study it, but we did talk, and I do feel like this is a good change. I feel like it's a good change, and I know that committee may not be ready to support that, but I think it's a good change because what we're trying to do, and I said this last time, is develop a pipeline for these students to get in, especially ones from areas like mine in a rural area. A lot of them can't dream of going to a master's program, but when they get in the profession at an associate's level and then they see, I can move on up if I do a bachelor's and then I can move up higher. That's what I want to create, is a bachelor's program for these students, especially in these rural areas like mine. And so I really think that I would like for the parties to be able to have some feedback on that, because I don't want to create any issue that I'm not aware of with the name change. But on its surface, I think it's a good step. So I just wanted to say that before, and I'm willing, if everybody's okay, to move that on the floor unless there's something
you're not aware of
that I'm not aware of. So.
Well, and I think that's appropriate. And you get that time, you can tell it's a friendly amendment, and it should be fine. All right, that concludes. I'm sorry, Representative Hall.
I just don't want anyone to think that the concerns raised as it relates to the community college and the program, that it is anti. It's not the purpose at all. And you've indicated that we are going to make that correction. So, because if that is the case, I have a statement that I think would correct where we are on that particular issue as well. Thank you.
Okay. All right. That concludes our health committee meeting. Thank you. Thank you for your
We
work.
got to vote on.
All right. Yeah, I voted enough yesterday to take care of about 3 weeks worth. All right. All those in favor as the bill amended or substituted by saying aye. Those against, nay. Now it passes. Okay.